chat box, and we'll answer them as they come in. If sometimes we may just reach right back out to you and give you a question through the chat box, or if it's something that makes sense to ask for the group, that's fine. The other piece, if you have kind of more broad-based questions, we will be offering office hours every other Friday at this time for the next 6 months, so you can always join our office hours and ask questions there as well. So that I want to just take a minute and go through our agenda, and then we'll jump into things. So we're just going to give you guys a very brief overview of what the Clinic Technical Assistance Center is, for those of you who've been involved in our other projects, or who have been, for those of you who've been involved in our other projects, or who have been to some of our leadership forums, have kind of heard that. We're going to talk a little bit about our partners and also who's involved in the BEAM initiative. Then we're going to go through some of our lessons learned from our BEEP initiative. We're kicking with beeps and beams and laser-like focus and that kind of stuff. So we're going to go through a little bit of our lessons learned from our BEEP initiative and how that applies to the current BEAM project. I'm going to go through very briefly a little data that just comes out of your applications in terms of what the clinics are, where you are, and all that kind of stuff. Then we're going to go into a pretty detailed overview of what BEAM is going to be and what BEAM is going to look like, and hopefully be able to kind of lay out the logistics of the next 6 months for you so you have a really good understanding of exactly what the project is going to look like. Dave Wawryznek is going to talk very, very briefly about our CTAC Financial Benchmarking Tool, which will be kind of our main focus tool throughout the project, and then our next webinar, that will be really the primary topic, and then we'll be working through it over the course of the thing, but we just want to give you a brief introduction to that. Talk a little about some of our collaboration tools, and then talk about action steps moving forward, and then we'll kind of wrap up and let you go, and we will be done by 1 o'clock. So so that's kind of what we're going to do over the course of today. So in general, CTAC really is focused on providing training and intensive support on quality improvement strategies, including business, organizational, and clinical skills, to all New York State mental health clinics. So there are 500 plus or minus a couple, because people add and lose clinics over time, but there are about 500 mental health clinics throughout New York State. And we are deeply committed to working with all New York State mental health clinics, and couldn't be more excited that so many have been able to join this initiative. And I think one of the things that makes CTAC unique is really the focus not only on clinical quality and clinical improvement, which is what a lot of technical assistance centers, but also business improvement. And so we really are trying to meld those two things together into our project. So that's really the overall goal of CTAC. I'm going to skip through this. You'll get the slides after this, and you can look at them in more depth. But really we're dealing with a drastically changed not only mental health system, but also healthcare system, and it's changed a lot up until now, and it's going to change even more going forward into the future. And so I think what this says for CTAC is just that we're really focused on making sure that we are doing whatever we can to prepare clinics around New York State to really kind of be ready for those changes as much as possible. I think I've got I think that that we've really focused on a colleague of ours says it's like trying to tune up the car while driving down the road, but I think I try to think of it as a little bit more intense than that. It's almost like trying to change the transmission of the car while driving down the road. And so there's no real person or agency to point to and say that they've got all this figured out. And I think that's one of the unique things that's happened in this period of change versus some of the other periods of change that we've gone to. So in terms of partners for CTAC, I just want to kind of go very briefly through who the partners of the global CTAC initiative are. So CTAC is really housed, and many of us live at the McSilver Institute for Poverty Policy and Research, which is part of the NYU Silver School of Social Work. We have a number of really excellent partners in this project and CCSI and ICL, who I really want to highlight, are really leading our business practices initiatives, including BEAM. ICL brings a tremendous amount of experience in terms of business practices on how to actually run clinics in the real world. CCSI has done a large amount of work throughout New York State, really working closely with clinics, both not-for-profit clinics as well as county-based clinics, in terms of orienting their financial information and those kinds of things. The Urban Institute for Behavioral Health, which is where I am, has now moved to NYU, and we are part of the McSilver Institute. Families Together, which is an advocacy organization and peer-run organization for family advocates. NIAPRIS, which, as I'm sure many of you are familiar with, is a peer-led organization that focuses on advocacy as well as focused on peer-delivered services. The Coalition for Behavioral Health Agency, which is an advocacy and trade organization in New York City, does a tremendous amount of training as well as IDEAS, which is the center at NYU Medical School, which is headed up by Kimberly Hoagwood. So I want to just talk a little bit very briefly about our relationship with OMH, because that's one of the things that, you know, is kind of a question, and so I just want to lay this out. We've talked about this in the leadership forums. We'll just be very clear about this. So CTAC is funded by OMH. OMH provides all of our funding for the CTAC stuff and has been able to bring this to you. And I want to give OMH a lot of credit, one, for putting this resource out there for agencies, but also for recognizing that not only do agencies need clinical best practices, but also they need business best practices. And so, one, in terms of being able to provide us with funds to be able to do this, but also in terms of giving us the flexibility to really start to devise these interventions, which we're hoping are going to be really effective for helping folks get themselves organized going forward. We do really view this as a funded OMH initiative, but a separate and distinct relationship from OMH. So the folks who work on CTAC are not OMH staff. We come from the partners that we just discussed. And so just a little kind of couple things in terms of the information sharing. So, you know, OMH has asked that we, you know, share like who, you know, just kind of what agencies participating in projects, and we will share that information. But I want to be very, very clear, and we've been very clear with OMH about this, and they understand this and agree to this as well, that we do not share individual clinic, financial, or clinical data with OMH at any time. They have occasionally asked, and we've been able to contribute some de-identified data that we've gotten, and just like we're going to show a little bit of some of the de-identified data that we've gotten as well today, we will show some de-identified data just to kind of show trends and that kind of stuff and what we're seeing in the field, but we do not share any individual agency's financial data or their clinical data if they participate in one of our clinical projects with OMH. So I just want to be very, very clear about that. And then we do also sometimes participate in conversations with OMH kind of about what we're seeing in the field and not around specific agencies, but just more globally about what we're seeing in the field and you know, kind of the trends that we're seeing. But the CTAC as an institution even does not engage in any advocacy activities in a formal way, although many of our partners do. So, for example, obviously the coalition engages in advocacy organizations, IAPRIS and Families Together, and others do as well. But that we, CTAC as an institution, do not participate in advocacy or any advocacy activities. I want to take a very brief minute to just kind of introduce everybody here. And this is our CTAC team that's going to be working on BEAM. So I'm going to ask the folks who are with Justine at ICL to unmute their line real quick and introduce themselves very quickly, and then we'll go around to the other folks as well.
Okay, I guess I'll start. My name is Elizabeth Kleek. I'm the Vice President for Program Design, Evaluation, and Systems Implementation at ICL, and really glad to be a part of this team and to be working with all of you. With me, but of course, having stepped out of the room, are Chris Copeland, ICL's Chief Program Officer, and also Dewey Howard, ICL's Chief Financial Officer, are also part of this team. And I think, Scott, are you also on the line?
Yes, I'm Scott Pidgeon. I'm the Vice President and Business Manager of ICL's Clinics. Also happy to be here.
And Justine?
Hi, I'm Justine, and I'm the project manager for CTAC's business initiatives, and I'm also at ICL, and so I'll be your point of contact for this practice improvement network going forward.
And I just want to give Justine credit, because Justine really makes sure that all of this actually happens. So we just always want to give Justine credit for that, because she's really make sure that this happens. Donna and Dave, do you guys want to introduce yourselves real quick?
I'm Donna Perry. I am the Senior Vice President for Coordinated Care Services. We are a management services organization in Rochester, and I am very proud to be one of the CTAC partners and looking forward to working on the BEAM initiative.
Good morning. My name is David Wawryznek. I'm the Senior Vice President of Finance for Spectrum Human Services, a behavioral health organization in upstate Western New York. Work as a consultant to CCSI, and you'll be hearing from me in the coming months as we work with you around your financial modeling tool. Thank you.
And Julie?
Hi, I'm Julie Gachowski. I'm Managing Director of Clinical Operations at Spectrum Human Services in Western New York.
And Peter?
Hi, I'm Peter Campanelli. I'm the President and CEO of ICL, and we are delighted to be a partner in this initiative.
Hi, and I never introduced myself, and I'm Andy Cleek. I am the Executive Officer at McSilver UIBH here at NYU, and really in the background coordinating a lot of these initiatives and trying to, work to make sure kind of CTAC gets off the ground. And you'll notice that we don't have pictures for Dewey and Chris. We have a nice happy face pictures for them now, and we've promised to come up with more and more embarrassing pictures over time to encourage them to give us pictures of themselves going forward. So we're going to move. We're going to kind of put two polling questions up here. So I'm going to read through this, and then on the right hand side, you can click on your answer. We just kind of want to get a sense of where you are. So in terms of your clinic operations and joining BEEP, what are your primary concerns? So 1, balancing fiscal concerns with quality of care, managing staff productivity, improving access to services, changing our payer mix, other, or not sure. And if you could just click on the right side of your screen in the window, click what's the most important to you, and then hit submit, and then in about 10 seconds, Justine's going to show us the results. Yeah. All right, Evelyn, can you show us the results of that poll?
Hi, Andy. It's Justine. We're just waiting for the poll to load, so bear with us. We had a lot of people respond, which is exciting. Hold on.
All right, so it looks like, oops. Yeah. So I'm sorry, I'm just trying to expand my screen so I can see this. 1 second. There we go. All right, so it looks like the vast majority of folks said that balancing fiscal concerns with quality of care was the most important thing, which was relatively fairly closely followed by managed staff productivity. So that's pretty consistent with what we've heard from other folks in talking to many of you over time, and seems to be pretty consistent. So we're going to move on to our next polling question, which is how has your agency implemented any of the following? So either open access, and when you answer this, you don't need to fully implement it, but if you either try to implement or start to implement some of these practices. Open access, centralized scheduling, collaborative or concurrent documentation, same thing, but two different ways of describing it. Engagement sessions or groups. None of these sessions are I don't know and I'm not familiar with that. So if you could just take a second to answer, and then we will publish the answers. All right, can we publish the answers?
Yep, so we're loading the answers now, and we'll share them in 1 second.
All right, so it looks like people have tried to implement some of these things. It looks like most frequently named was collaborative or concurrent documentation, which makes sense because I know that a lot of folks have been working on that, as well as a bunch of folks have started to work on the issue of centralized scheduling and open access as well. So it looks like a large number of folks have tried to implement at least one of these strategies, and a smaller number of folks haven't really gotten to that point yet. So I think that's great. And I think one of the things that we're going to try to do with BEAM, as well as what follows BEAM, is really to kind of meet people where they are, so that they can, because every agency is going to be in a slightly different place. So with that, Donna, I'm going to pass the controls on to you, and then you can take the next couple slides.
Thank
you. So it should be on its way to you now, and there you go.
All right. Again, I'm Donna Perry, and what I'd like to do is share with you a little bit of background in regards to the Business Practice Initiative, which is just one module of the Clinic Technical Assistance Center. CCSI, in partnership with ICL, have really been the leadership team. And our goal through, assessing the changing behavioral health care system has really been to provide tools to support clinics in assessing and changing their current clinic practice in order to sustain or improve financial viability. We've been able to accomplish this through a series of in-person meetings. For example, this past fall we had our leadership forums. And then we've also, of course, had our BEAP Learning Collaborative that I'll talk about momentarily, and now we have our BEAM Learning Collaborative. For the BEAP Learning Collaborative, we've been together for almost a year now. Its participation is 25 clinics across the state of New York. We have a mix of upstate and downstate. And how the two projects are similar to one another, they both rely heavily on the financial benchmarking tool. This is a core tool for both of these learning collaboratives to support assessing the clinic program where it is right now, as well as reporting back on some very key and critically important performance indicators. Also, the core concepts and values are very consistent. The fact that in order to have an effective change practice, you need buy-in across your organization, across all levels of your organization. And it's critical to have very, very effective communication between your clinical folks, your operational folks, and your fiscal folks. That's important in order to have a data-driven decision-making process in place that will be successful. How the BEAP and BEAM are just slightly different is that the BEAP initiative was a mix of in-person, phone, and online contact, and the BEAP initiative also focused on an overall redesign and assessment of the financial processes and operational processes, where the BEAM initiative will focus more on a self-assessment. So some of the lessons that we learned is, again, as I mentioned before, it is just so critically important to have very good communication and collaboration across the organization. Also, the time that the agencies spend actually in the BEAP Learning Collaborative, face-to-face or on webinars and calls with the BEAP team is just a small amount of time that is invested as compared to the time that they need to invest in-home, in their office, in their operations, in order to make it happen. So it is a big time investment. Financial expertise is extremely important. Your numbers tell a story, and it's so important to have your fiscal people at the table working with your clinical folks in order to be able to effectively tell that story. I mentioned the need for having buy-in and also a very, very in-depth understanding of that financial benchmarking tool. As I mentioned, that's a core tool to this process. And the modules that will be coming up in the BEAM Learning Collaborative are really going to break that tool down and support you in developing it. I now wanted to share a little bit of data with you that we have collected in the past from our BEAP folks. What you have in front of you is units of service, weighted CPT units of service per direct care FTE. One of the things that we've realized is that it's so important to have very consistent and clear definitions so that when we go through our change practice and monitor our performance indicators, that we are all comparing the exact same thing. So you can see that we have quite a bit of range here. Again, our assumption is this is weighted CPT per direct care FTE, with the norm kind of falling between 55% and 65% as a productivity percentage. Another picture to share with you is the net cost per unit of service. So this would be taking your organizational expenses less your revenues and dividing that by your weighted CPT. As you can see, we have many programs that are showing an operational loss. This probably isn't surprising to folks. At the same time, though, while we are seeing a loss, I think it's important for people to realize that we're also seeing a change. As a result of the BEAP Learning Collaborative, we're starting to see through the change practice and improvement that folks are going through, we're starting to see a difference in their numbers. So we're starting to see improvement, and it's really important to realize that, yes, change can happen, yes, improvement can happen. However, it does not happen overnight. It will take time, and again, it will take a significant investment of your staff time and resources. At this point, I will turn it back over to Andy.
All right. So thank you, Donna, very much for walking us through that. I think it's, really important, and one of the reasons that we've structured BEAM in the way that we have to focus much, much more intensely on the assessment process first is because of what we learned from our BEAP project, that people really, we just got a lot of feedback from clinics. They really wanted much more intensive kind of like, how do you get organized and how do you get all of these financial things in one place? And so the reason that we're starting with a much more intensive assessment process is because we really learned that from BEAP. So I think it's really kind of nice to hold those things in mind. So I just want to show folks a couple slides to just kind of lay out exactly kind of who you all are. So you'll notice from this slide, this is all of the BEAM clinics that have signed up. And you'll notice that, there's a large number down in the New York City and Long Island, Westchester area. But then we really do have BEAM clinics from all over the state. So we really do cover the entire gamut of the state. Just want to note that we have 12 participating BEAP clinics who are also doing this, and we haven't included them in this graph. So we have 72 clinics signed up at this point. Fairly evenly distributed around the state. This is actually pretty consistent with the way that if you break down the clinics, about half the clinics in New York State are in the city, and then the rest are spread out around the state. And you'll notice that kind of pretty much holds up here as well. So we were really glad to see that distribution hold up too. So we asked people to describe their organization. Probably about a little more, more than half describe themselves as freestanding community behavioral health providers, so a traditional kind of not-for-profit behavioral health agency. 15 agencies are either county or state operated. We have 11 hospital-based behavioral health providers, and we're really glad to see that. We had a couple in BEAP too, and we're also really glad to see that hospital behavioral health clinics are joining this initiative as well. And then we have two agencies that are part of FQHC. So I think, the FQHC system is somewhat different, and so we're really glad to see those folks on as well. And I think we'll be able to hook them up with one another so they can kind of work. Because one of the things that we do notice is that there are similarities across these types of different systems. And so one of the things that we're going to try to do with this is make sure that people have the opportunity to connect with one another who have similar types of programs, because they often have similar types of issues with clinic practices. The other pieces, we just ask folks to identify them as themselves as either suburban, urban, or rural, and so you can just see the breakdown there that there is there's representation in all of those areas. And then we actually have a pretty diverse group of agencies in terms of both agencies that focus on kids, a large number of agencies that focus on adults, as well as agencies that focus on older adults as well. So just to highlight that. So we really do have a diverse group. And then the average number of clients seen, and this is client contact hours, I think, and not necessarily individual, not necessarily always unique clients, but the average number of clients seen over the course of a year, and this just, so we have a pretty diverse diversity here, with Long Island having a large number, which I think was skewed by one particular agency that sees a lot. And then the other thing we asked for you guys to fill out, which we're really glad that you did, was to highlight, whether you use an electronic medical record, and then kind of what are the electronic systems that you use. And one of the reasons we did it is I think one of the things we're looking at here is to be able to start to hook people up with other agencies that use similar electronic platforms. Because one of the things we've learned through BEAP and through other initiatives is that different systems collect different data in different ways, and getting that data out of different systems is often problematic. And so, being able to work with other agencies who are in the same boat can be helpful. So almost all of you are at this point using an electronic medical record of some kind in different levels of implementation, and so we're really glad to see that, and it's something that we've seen more and more over the last couple of years, is that those trends are really coming through. So now to talk exactly what we're going to be doing with BEAP, or BEAM. So then over the next year, we're going to roll out two separate but connected initiatives. So the first one is what we're talking about today, which is BEAM. And this is really focused on self-assessment and really getting a very, very good handle on an agency, on your clinic operations and your finances. The second piece of that is once we've gotten that piece sorted out for everybody, then we're going to roll out our Phase 2 project, which we haven't named yet. I'm still holding out for HUNK, but no one agrees with me here at CTAC. But our Phase 2 project, which is really going to take what you learn in BEAP and then figure out how to apply it in your agencies and actually roll out that change process and actually make all the changes that you identify that you're going to make through the BEAM process. So I'm not going to go through all of these in incredible depth, but you know, we've identified a mission for BEAM. We really want to help agencies build their organizational capacity and then provide opportunities for clinics to interact and exchange information with one another as well. But we are really focusing on, you know, creating a very robust self-assessment planning and evaluation structures, so really that agencies can make sustainable changes over time. So we really hope that this is the start of a process. This is not in and of itself the whole process. That, you know, that agencies are really going to take the information that we're able to help with in BEAM and apply it in their agencies going forward. So our primary goals are, one, you know, to really improve that self-assessment process, to you know, to really focus on agencies really building up their available capacity. You know, and Donna mentioned this, and this is really important. The time that's spent with BEAM and on our webinars and those kinds of things is not anywhere near the amount of time that we all know that's going to get spent in agencies on the outside and the work that you're going to be doing in your agencies. And that work that you guys are going to be doing is so much more important than, you know, what we're able to help with here. So I just want to highlight that. One of the things that we're going to focus on really is helping folks put in together the infrastructure that they need to be able to really collect data and analyze data and use data to really make financial decisions based on data. And then really to start to make those structural changes in the agencies, and then really recognizing, and Donna highlighted this, and this is something we're going to highlight over and over again, the interconnectedness between an agency's clinic operations and their financial operations and how those two things are going to be able to work together. So we're going to very much highlight leadership focusing on operational management, and that those folks in operational management will have a really good sense of an understanding of the financial structure of the organization, and that they will begin and be able to make data-driven decisions for daily operations of the clinics. Now, some agencies are already doing a lot of this, and for some agencies this is a really new approach, and for some agencies those decisions are made by one part of the agency and not by other parts of the clinic. And so, you know, we're really focusing on democratizing information and having agencies be able to make these decisions overall. Also, that all staff will be aware of and understand their role within improving the clinic's financial status. So I know that when I worked in a clinic many years ago, you know, I knew I got a paycheck and I knew that somehow the services I provided got billed for. But no one ever actually sat down and explained, like, how many hours I needed to bill for in order to pay for the services that I, you know, in order to pay for myself. And so I think one of the things that we really are going to work with folks on is kind of how to have those conversations and how to do that. And then also to be able to set up realistic short-term performance benchmarks in order to really kind of make this change over time. Goal 2 is each agency is going to work to develop a strong core team to really enable the long-term re-engineering of operational fiscal structures. I think one of the things that we've seen a big benefit from in BEAP and also other projects that we've run is really bringing the fiscal people together with the clinical operations people, as well as some of the other folks in the agency, to work and develop these things together is really key to success. And in some agencies that already happened and that was great, but in other agencies, you know, the CFO and the clinic director often really had to introduce themselves, and so that's a really key piece to being successful with this. And then also working with agency leadership to address both internal barriers but also external barriers. And then working on a continual process of monitoring, continual quality improvement, so monitoring the structures as they get rolled out. And then we are going to try, and like Justine likes to say, that we like to really give people the opportunity to steal shamelessly from one another in terms of things as they develop. So through BEAP, and we'll continue this through BEAM, we have something we call like the beep of the month, and we really kind of, take something that somebody has developed and is working really well with their agency and with permission. We share that with other folks, and we really want you guys to be able to learn from one another. We want you guys to be able to learn from one another and be able to, kind of use those things that others have developed. And then we will connect folks and give people the opportunity to engage in brainstorming sessions and really to kind of figure out some of these things going forward. Okay. All right. So our guiding principles are that we want you have to take a structured approach to changing your clinical operations and finances. We really believe in data-based decision-making here. I think that's one of the real core tenets of what we're going to do here. Build strong relationships across both finance staff and clinical staff. Sequential learning. So we've set this up that each module builds on the previous module so that you don't just get all this all at once, that each module will build on itself. And there's a tremendous amount of time investment on you guys' side. And I think, so unlike traditional models, and I know some agencies have phoned and brought in folks like David Lloyd and those kinds of folks, they come in, they take your data, they tell you what you need to do, and then they really guide that process. And I think one of the things that's different about this, and it's different for a couple reasons. One, we wanted to make sure we had the opportunity to provide this service to as many agencies as possible around the state. And so in order to provide that very intensive individualized consultation, we wouldn't be able to do that to agencies around the state. So we just wouldn't have the capacity. But the other reason is we really do want agencies to really, kind of make these decisions on their own and implement this on their own. But there is a lot of time investment that's going to happen on the agency side. So just very briefly, what folks have already done to us, done and submitted to us already. We've already got your online demographic data. You've sent in your cover sheet. You should have identified at this point your core implementation team consisting of somebody from the clinic, somebody from executive leadership, as well as a finance representative. And then again, as you'll hear over and over, it really is important to have all three of these sources, people on the team to be successful. Okay. This is kind of just a little bit about what we hope the different types of members of your team get out of the BEAM project. So for the finance staff, we hope finance staff get a really good understanding of kind of how financial data relates to the frontline clinical operations. To be able to more clearly identify a model, how different operational changes will affect fiscal viability. So one of the things that we really like about the benchmarking tool is before you make a huge change in your agency, you can actually plug in all your stuff and say, so if we were to increase our productivity by an hour a week per clinician, what effect would that have on our bottom line? You can project all those changes out. So before you start making big changes, you can actually figure out which changes you want to make and what effect they're going to have. And then for clinic staff, really want to hope that folks will be able to embrace numbers and maybe even love them a little bit. Most of us on the clinical side of things, we did not go into this because we were fantastic at math. Many of us actually went into this field because we weren't very good at math. And so we really want to kind of help folks really get an understanding of how these numbers affect operations, and for some of you, you may even develop a little bit of a love for them. And then what staff does affects the viability of the clinic, and then all staff learn how to approach these changes as a team. So just very, very in terms of kind of basic structure of how this is going to work, we are going to offer 2 web-based trainings a month through June. Each represents a step towards an in-depth understanding of your financial situation and developing a plan. So we've kind of really laid these out sequentially so each one builds on another. So we'll have 2 of these trainings a month, and I'm going to go through each of them in a minute. We're going to have office hours on alternating Fridays. So you'll have a web-based training like today. So this is our first kickoff, right? And then next Friday at this same time at 12 o'clock on Friday afternoon, we will have representatives from the CTAC BEAM team. They will be on the phone and be available to participate in office hours. So as you develop questions over time, you can participate in the office hours and bring them to that. So there'll be an hour devoted to questions and an hour devoted to learning. We're going to offer a couple supplementary trainings based on specific topics, and I'll talk about that in a little bit more. And then each agency will complete and submit their benchmarking tool on 5/7. So May 7th, you'll have all the information you need at that point. You'll be able to submit your benchmarking tool to us, and then we're going to provide some basic analysis of that tool and give it back to you. Okay, so web-based training structure. So each of our trainings are going to kind of follow a similar structure. So the first thing we'll do with each training is check in on the previous web-based training and the action steps that were completed by folks. We're not going to go around the phone to everybody because obviously there'll be 70 agencies on the call. But we're going to check in a little bit on what we learned from the last one and some of the action steps. We may also kind of recount a little bit of some of the key points that came out of the office hours the week before. We'll give a brief overview of the goals of the training and what we hope to accomplish that day. We'll spend the majority of the time of the training going over the content. We'll have an overview of the action steps that people are going to need to complete on their own prior to the next training. And then we'll do a little bit on Q&A, and that'll be the training. Each of these trainings will be an hour, so we are really going to be packing a lot of information, into that hour. All right, so I'm not going to go through each one of these individually because I want to make sure we have time to get through everything today. But we're going to have 11 modules. We're starting with the benchmarking tool on the 15th of February, so everybody will be right back from Valentine's Day. Hopefully everybody will have had a wonderful Valentine's Day. And then we'll dive into the very romantic topic of financial benchmarking tools and give you an overview of that tool. And then over the next several weeks after that, we'll break that tool down into its component parts, indirect costs, direct costs, converting and analyzing CPT weights, using utilization of CPT weights. And then once you get all that information together, we're going to start to help you guys develop a strategic plan based on the information that comes out of your benchmarking tool. We'll go through how to develop a financial tool based on a financial model based on that benchmarking tool that'll be fiscally viable. Help you guys identify your personalized indicators that you're going to use going forward so you can actually measure the data as you train, and then we'll wrap up at the very beginning of February, and then from there we'll transition into the next phase of the project. Office hours. So as I mentioned before, office hours will be held on alternating Fridays from 12 to 1. So one week like today, we have our kickoff webinar. Next week we'll have an office hour where anybody who has questions from this webinar can come on and ask those questions. Will be the resource team members who present at the webinar the previous week will be on the office hours in that week, next week, to answer questions. You can submit questions in two different ways. You can submit questions during the webinar, and any questions that we either can't answer or can't get to in the webinar, you will answer them the next week on the office hours, or you can submit, we'll send out a separate, Jesse will send out a separate request for questions. You'll be able to submit those questions in advance, and then we'll be able to make sure we have the answers to all those questions if we have to do any research, and we'll be able to answer those questions on the office hours. You can also submit questions during the office hours. We just want to make sure that people get an opportunity to submit in advance so we can make any preparation for those questions that we have. And the office hours. So the webinar web-based training schedule is really required. It's part of your participation in the project. The office hours are not required. They're open to everyone to participate. But if everything made sense in the if everything made sense in the webinar the week before or the web-based training the week before, there's no need for your agency to participate in the office hours. So this is the office hours are a new thing for us, so we're going to see how that works. It's just a way to kind of organize things. We're also going to offer some supplementary webinars. One of the things we got a lot of feedback back from in BEEP was that for some folks, especially some of the clinic folks, just a really basic understanding of Excel was needed, that some folks really needed that. For some of you, especially the finance folks, Excel is something that you understand very well. But for other folks, they just need a really basic understanding of that. And one thing just to highlight, if you have questions along the way, please feel free to type them into the chat box, and we'll try to get to them at the end. And we're also going to do on a therapist self-monitoring tool on how do you kind of monitor productivity, how can a therapist monitor their own productivity, and then we're going to date to be determined, tips and tricks on running effective meetings, which is something we've also gotten some feedback from folks that they've asked for. And we may add some others on. So what happens after BEAM? So after BEAM is over, we're going to bring in MTM services, We're also bringing them in this month for the BEEP, or this month and next month for the BEEP agencies, but we're going to bring them in again over the summer to talk about three things: open access, centralized scheduling, and concurrent documentation. Then we're going to group agencies together based on current challenges and needs, and have a series of special interest call and offering for those agencies. So if your agency is going to focus on open access, then we're going to group you together with other agencies who are doing that. And then we'll provide other guidance on the performance improvement process and those kinds of things. So with that, Dave, I'm going to ask you to unmute your line and talk a little bit about the benchmarking tool, and I'll move the slides for you.
Okay, thanks, Andy. The fiscal benchmarking tool is an Excel-based financial modeling tool. It's called a benchmarking tool because it was designed really originally to allow clinics to be able to set benchmark values for some key variables, financial variables, and operational variables to project out financial viability. The model takes a look at your services, your service mix, your payer mix, indirect versus direct care costs. Does your reimbursement meet expected costs? It allows you to project how different changes will affect the bottom line, and help you develop a staffing and financial plan to optimize your fiscal viability. One of the things that the tool also does is allow you and your individual circumstances to determine what variables are most sensitive for you. And what we like to work with people is an ability to maybe identify 3 small changes that you can make in your clinic that will have a significant financial impact, and allow you to find variables that you have control over, project changes that are achievable, and create a benchmark standard that you can monitor as you go forward. If you want to take a look, the next slide is a real quick little snapshot of the benchmarking tool. There'll be a basic convention about how the tool will be used. We'll build your structures and your cost structures and your revenue structures over the course of our webinars, and we'll have you at a period where you can begin running different scenarios affecting different variables to be able to project out where you need to go. There'll be certainly much more information starting in the next webinar in 2 weeks, and we look forward to working with you all. Thanks, Andy.
Great, Dave. Thanks so much. All right, Justine, I'm going to pass you the controls, and you're going to go through real briefly some of the other logistics of what's going on, and then we're going to be able to wrap this up pretty soon because I know we're running up close to the hour.
Hi everyone. So I'm just going to briefly go over some collaboration tools that are also some tools you can use during your participation in BEAM. So, we at CTAC strongly believe that one of the most valuable parts of participating in these practice improvement networks is the opportunity to be able to interact and learn from your fellow providers. And the office hours are one way for you to do that, but we also wanted to have provide informal methods for you to be able to communicate. So I'm going to briefly review right now our listserv, which is one way you can talk to the other providers who are participating in BEAM, as well as the Basecamp resource site, which you can use to download resources and post messages about issues you're facing. I'm going to review them now. Instructions were also sent out in an email earlier this week from Jessica Reisal, who is our CTAC Communications Manager. So if you have any further questions or if you didn't receive the instructions, you can email me. My contact information is at the end of the slide. So just to go into the listserv, it's available on our CTAC website. You can go under our trainings, and it will be under BEAM and BEAM discussion board. It's a private page that's only open to BEAM clinics. So you need to have the password in order to enter, and that password is CTAC Forum. It's a forum to talk with fellow BEAM clinics and ask questions of one another, and sign-up instructions were emailed out this week. So just on the home page, you can register, log in, and start a discussion topic. So you can see right here, this is where you can register. You can click there. You can use the email and login of your choice, and that's what you can use going forward. If you want, going forward, you can log in from this button right here. And then you can post new topics using the new topic selection. Within a topic, you can hit reply and respond to previous people who have posted. If you want to receive email notifications about within the discussion board, that you can go into the options section, and there's the option to subscribe via email and also post via email. So if you don't want to be visiting the website, you can do all of this via email. I think it'll be different for all of you, so we've offered these different options, so some people might not want to be receiving emails, and they just want to go onto the board and look and see what's happening. Other people might want to be more involved. And on the subscribe page, you can also choose your options. You can choose how often you receive emails. So you could either say, I want an email about every single message posted to the Beam discussion board, about new topics only. You can opt to have an individual email, or you can get a daily digest that summarizes all the emails that have been posted that day. So I'm going to go briefly over again our Basecamp site. So the Basecamp site, we use this as a Beep Learning Collaborative, and I think they found it really helpful. It's a resource site where they can access resources. You can also upload your own resources that you're using to share. There's a calendar where you'll be able to see upcoming events, and you can sync the calendar on the Basecamp to your Outlook. So that could be really helpful if you don't want to enter them all in every time. You can also communicate with your fellow clinics this way, and again, we're providing different methods for you to communicate as a way to really, see what works for you. This is an experiment for us as well, so we want to see what is the best methods that you choose to use. And you'll receive an invite to the site by Tuesday of next week to access it. When you'll log in, you can also, again, choose your login and email. You will see an overview page. The overview page will show the calendar briefly here. You can also see your activity, recent activity on the site, which is similar to a Facebook news feed. And you can also see right here different members who are on the site with you. Under the Messages tab, you'll be able to under the Messages tab, you'll be able to write messages. You can upload files. So this is, again, good if you want to share files with one another. And you can also notify people when you upload these files. So this is different than the listserv in that anytime you upload to the listserv, anyone who subscribed to an email notification can see it. Here you can actively choose who will get an email notification that you've posted this message. And then the file section, I think this is probably one of the most useful parts of the site. You can upload files and also download files. So we'll be uploading the slides from every training onto the site. We'll also upload notes from the office hours, and then any other resources that we think might be helpful to you. And again, we welcome you to upload your own files or resources that you are using to share with the fellow Beam clinics. And with that, I'll turn it back to you, Indy. Thank you.
All right, and there was a question that came in about whether we'd offer individual consultation to folks after the modules are completed. I think we may be able to work out something through the office hours process, but we have to think that through. I think one of the things that we decided as we went broad with this is that, it does kind of prevent us from offering intensive individual consultation to folks, but we may be able, as we kind of sort out the office hours process, to figure out ways to offer a little bit of individual time to folks as they need it. So it is one of those things that we are going to sort out. And so just, kind of keep in touch, and we'll fill you in on the details of that as we go forward. Okay, so action steps before the next webinar. First, on the 6th, so next Wednesday, the benchmarking tool will be available online. So there were some, recent changes that came out in terms of billing and CPT coding and that kind of stuff. So we're adapting we're adapting the benchmarking tool that we use to meet those changes, as well as kind of cleaning it up and making it a little easier to use. So it'll be available on the 6th. So the first thing you're going to want to do before our next webinar on the 15th is download that on the 6th and kind of review it and go through it and get a sense of it. We are also going to post today's session on ctacny.com on the 6th. So you can access our stuff on the 6th. To, if you had other people who weren't able to attend, they'll be able to access the webinar on the 6th and can view it. That'll also go forward for all of our web-based trainings. That'll go forward for all of our web-based trainings. They will be available probably the next week on our website. So if you have members of your team who weren't able to attend a particular training and need to get it later, they're welcome to go on, and it'll just be a video of what we did today and what we did in the supplemental things. You want to start to begin meeting with your core implementation team, and then as Justine mentioned, you're going to want to start signing up for Basecamp and the listserv, because a lot of information will flow through those sites as well. So I want to give a little not orientation, but a little publicity for our webinars. So we're bringing in David Lloyd's group, MTM Services, to do a webinar on open access, collaborative documentation, and centralized scheduling. One at the end of February and two at the beginning of March. That's going to be for our BEEP clinics and focused less on what is open access and what are these services, but more on implementation challenges. But we are opening that up to all BEAM agencies as well as BEEP agencies and all agencies around New York State to participate. So we're going to be polling our BEEP agencies to get specific questions that they want to make sure they get answered in those webinars. But we think it'll be helpful for everybody. So for agencies that want to get a little more intensive understanding of what these practices are, as well as some of the implementation challenges that people are experiencing now and how to overcome them, we welcome you to please participate in these webinars. It'll be a nice thing of kind of getting oriented to what will come in the future. And so registration information is going to be coming in the next couple days. We really look forward to having you guys on those as well, because I think it will be really helpful for folks. In the future, so you can contact, our primary contact for all things BEAM related is Justine. We've listed her email address, as many of you have already. And her phone number, but she wanted me to let you know that that the primary method to contact her is really by email. She keeps very close track of her email and has all this stuff segmented out so that she's really able to kind of keep track of this. And I think with voicemails, things can kind of pile up, and so I think email is really the best method of contacting her. And so please feel free to do that, and you can also look on our website, which for some reason when we uploaded the slides got covered with a question mark, but our website is ctacny.com, and you can also look on our website, and all of our stuff with regards to BEAM will be up there, and then the BEAM specific kind of confidential stuff between agencies will be up on our listserv, which you'll need the password, which Justine explained, will be there for that. So we really, really want to welcome everybody to the BEAM initiative. We are very excited to be working with each and every one of your agencies and your clinics over the process of the next 6 months to really drill down and get a sense of your finances going forward, and really help you to kind of develop a plan that will really be helpful to your agency in the future. So we are very excited to have all of you with us and part of the BEAM process together. And with that, we are going to wrap up the webinar. I think we are wrapping up 4 minutes, or 3 or 4 minutes early, so we're able to get this all in under the hour. If you have any questions following today, please shoot Justine an email. And if it's a really quick thing, she may be able to answer it really quickly, but then otherwise we'll be available next week at this same time on our first office hours. So if you have systemic questions or those kinds of things, please reach out to us in advance, and we'll reserve those for the office hours next week. We are very, very excited again to have all of you participate with us, and so pleased with the response to this initiative. So we look forward to working with each and every one of you over the next 6 months, and are very pleased to have all of you. And with that, we will wrap up the webinar for today. And we look forward to speaking with you all over the next 6 months and learning all about your agencies. Okay, take care, everybody.